Tomorrow, L.A. City Attorney Mike Feuer and DA Jackie Lacey will announce a crackdown on people caught price gouging during the coronavirus outbreak.
Price gouging is against the law, but that has not stopped some people from trying to cash in on other people's panic. CBS 2's investigator Christine Lazar went undercover and caught one woman in the act.
Yeah, as soon as the city declared a state of emergency, then when you inflate these prices, anything over 10%, that is against the law, and people need to know that. Now, Amazon has cracked down on this practice, kicking sellers off the site for inflating prices. eBay went a step further, banning all listings for face masks and hand sanitizers. But smaller sellers are often flying under the radar, charging as much as 1,000% the original purchase price.
I purchased them myself on Friday.
Just one day after the California Attorney General warned businesses and opportunists about illegal price gouging in the wake of the coronavirus outbreak, this woman was online selling face masks for $30 each. You know what you're doing is illegal, right?
What do you mean it's illegal?
You're not allowed to sell anything for more than 10%. You're price gouging. Back in January, the same 3M N95 masks she is advertising on her face masks Facebook page went for around $2 per mask.
If you violate our price gouging laws, you'd better be prepared to pay the price for your law breaking.
Last week, Attorney General Javier Becerra told Californians that if someone is caught price gouging, they could face jail time or steep fines, up to $10,000 per violation.
It is not open season to gouge consumers.
Two on Your Side was alerted to this Facebook page, so we asked the North Hollywood woman who runs it if we could buy 4 masks for $120. She responded, sure, you won't find them anywhere. And even if you find them cheaper, she suggested we get them ASAP, as I'm sure prices will rise. When we arranged to meet her outside a Target in Pacoima, she told us she paid $28 for them. Can you show me proof of that? Because
no,
that's not what they retail for.
You can't find them at retail.
Right, but you know that you're taking advantage of people worried about their health and marking up a price. On her Facebook page, the woman posted what appears to be a photo of boxes and boxes of the masks right from the manufacturer inside her home. Dr. Nicholas Testa is Chief Medical Officer for Dignity Health. He warns if these face masks are bought up by people looking to make a buck, there won't be enough available for our healthcare workers.
Right now, what we're seeing with the coronavirus is fear. Right? We're seeing a lot of fear in the community. But think about how scary that is if you're actually a doctor or a nurse who has to take care of a patient.
And with the demand high and prices skyrocketing, hospitals are now concerned about theft.
So we put out masks if you're sick to wear when you come into the hospital, and people are stealing those from the hospital.
As for this woman, she told us she ended up with the masks after she purchased them for a nonprofit, which later backed out of the deal. What organization is that?
I can't say.
Why can't you tell me what organization? I mean, if it's a nonprofit and they're trying to help people.
It was confidential.
We ended up not buying the masks, but informed her that she could face criminal charges if she sells them at such a high markup. So are you going to stop doing that?
Sure.
That was last week, and her Facebook page is still up. She even updated it with another photo of the masks she has available. And Dr. Testa says, save your money. Healthy individuals do not need these masks. The way people typically get infected is from coming into contact with droplets on surfaces like door handles and counters and desks. The people who need those masks are the people who are already sick, so they don't spit out those droplets on other people, right. And also healthcare workers who have to help the people who are already sick. But the three of us, if we're healthy, we don't need those.
No, and if we cough, we cover our mouths.
Yeah, in your elbow,
Please.
not your hand. In your
exactly.
You should
in
do
the
that.
elbow.
Exactly. All right, thank you, Christine.
Thanks.